Hi, I'm Erin Power.
And I'm Laura Rupsis.
We're certified health coaches, and this is Health Coach Radio.
This podcast is about the art, science, and business of health coaching.
We share our insider tips to help you become a better coach and entrepreneur.
And we interview expert guests to discover how they've made it in this growing field.
It's time for health coaches to make an impact.
It's time for Health Coach Radio.
Today's episode is brought to you by the Health Coach Success Virtual Masterclass. My co-host Laura and I worked hard to pull together this special online event just for you. It's a 5-day mini course in which we interview the best and brightest health coach and marketing experts on the planet to try to understand how they've become such great coaches and entrepreneurs. Included in the 20-plus expert interviews are some names you might recognize. Primal Health Coach Institute founder Mark Sisson, celebrity nutrition expert and New York Times bestselling author J.J. Virgin, author, cardiologist, and staunch health coach advocate Dr. William Davis, Michelle Liotta of Health Coach Power Community, Michelle Norris, CEO of Paleo FX and ID Life Nutrition, and many, many more. The Health Coach Success Virtual Masterclass is now available and totally free for a limited time. Check it out at primalhealthcoach.com/success. Dr. Michael Ruscio is the guest of the week on Health Coach Radio, and we could not be more excited. Dr. Ruscio is for sure one of our functional medicine faves, not to mention a guru of no-nonsense gut health. This was such a fun, nerdy conversation about a health topic that truly every coach should be up to speed on. And if you're not, or if you're questioning the currentness or breadth of your gut health knowledge, Dr. Ruscio has ample resources for you, including his awesome book, Healthy Gut, Healthy You, and a few free, awesomely educational downloads that he offers up on his website, drruscio.com. Remember that the show notes for our episodes can always be found at primalhealthcoach.com/radio. We'd love to have you screenshot your podcast app and tag us on Instagram at Health Coach Radio. We'll tag you back. And make sure to tag Dr. Ruscio too at Dr. Ruscio. There were a few surprises in this episode, some concepts around gut and thyroid health that might slightly blow your mind. This is one of those episodes where Laura and I could have literally talked for hours. We'll be sure to have Dr. Ruscio back for a follow-up chat. But in the meantime, settle in and get ready to learn with Dr. Michael Ruscio. Welcome to the show, Dr. Michael Ruscio. I'm excited to have you. Laura's excited to have you. We're big fans of you.
Thanks.
There's lots of stuff we're going to talk about with you today. So I'm excited to dive in. But what we really like to start with everybody is a little bit of an origin story. So why don't you share with our listeners, all of whom are aspiring or practicing health, fitness, and nutrition coaches, what it is you do, how you got here, and what you kind of specialize in?
Yeah, well, sure. So my journey started actually in college, and I was on par to go into conventional medicine, ended up contracting an intestinal parasite, didn't know that that's what happened, and was floundering with the conventional medical system, saw 3 conventional doctors. Why am I depressed? Why am I fatigued? Why do I have crippling insomnia? Why am I tired? As someone who 6 months ago, college athlete, feeling pretty much invincible, eating all organic, meditating, relaxing, doing all the stuff, right? And then all of a sudden just the wheels fall off. And so conventional medicine didn't really have any answers for me. And in health coach training, I was doing side training in exercise, nutrition, some of which was with the Czech Institute. They had another type of doctor they recommended to see called a functional medicine doctor, which I had never heard of. But I figured, well, I went to see an endo, an internist, and my GP, and none of them had anything to say. So what do I have to lose? So I ended up seeing a alternative doctor who practiced functional medicine, and he ended up diagnosing me with an intestinal parasite. And that was really the root cause of all my problems. Now, what's interesting, I think, as a little side note, in the interim, I read up on adrenal fatigue, thought I had that, used the adrenal herbs, got a little flicker of improvement, but didn't really get anywhere. Thought I had hypothyroid or thyroid conversion, which is actually a epidemically incorrectly diagnosed condition. As maybe a side note we can come back to later. It's actually appalling how many people are being told to have hypothyroid who actually do not. But thought I was either hypothyroid or had a conversion problem. So I did all the herbs for the conversion of T4 to T3 and the Hashimoto's protocols and saw a flicker of improvement and then back to baseline. Thought I had metal detox, did a urine test, showed high mercury, which you may know that some labs have even been sued for having fictitious ranges where everyone comes back as a positive. So the test that was positive was kind of, if I'm being totally candid, BS. And though I did the detox protocol and felt no better. So I went round and round for a while, low testosterone, another thing, tried that. And all the while chasing my symptoms leading me to different diagnoses, all of those weren't either correct or weren't really the causative factor. After maybe 6 to 8 months of floundering in that function, I found functional medicine and ended up figuring out I had a parasite, treated the issue in my gut. And that was really what finally got me past all the symptoms. So I then went into natural medicine and into chiropractic, the two areas that I'm trained in, kind of the alternative realm. And while there was a lot of good there, there was also a lot of dogma and a lot of woo-woo. And as someone who kind of came from a more academic and skeptical mindset, there was a lot of dissonance there. And I almost left and went into conventional medicine a few times actually during my schooling. But when I would call my buddies in conventional medicine, they'd be saying the inverse of what I was saying, but the same level of frustration. Oh, it's all about drugs and da 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 da. And I was saying, well, some of these people are crazy. They think, one adjustment or one herb can cure everything. And so there was dogma on both sides. So I said, okay, I'm just going to bite my lip, continue through on the alternative path. But it really kind of ingrained in me this skepticism, which when I got into practice, oh boy, it seems a lot of these tests are kind of BS. And some of these things that we think, these canards circulating, like everyone must be off gluten all the time. If you actually look at the best scientific evidence examining that question, you can't honestly arrive at that conclusion. But it doesn't stop certain people from making a living lecturing about how gluten is a poison for everyone and convincing plenty of people that that's the case. And unfortunately, when the incentives there aren't aligned, you can end up with this kind of one-sided messaging. It turns out there's this old, and sorry if I'm being a little bit verbose here, but there's this old diagram. I think it comes originally from a marketing textbook. There's a fork in the road, and there's one fork that says nuanced but true, and the other says simple but incorrect. And there's about 100 people on this line and like 2 people in that line. So I see where, from a human nature perspective, this comes from. But anyway, so as I got into clinical practice, I went from doing all the stuff, the heavy metal testing, the adrenal testing, the XYZ, blah, blah, blah testing, the MTHFR testing. And many of these things have now been shown to be highly inaccurate. And unfortunately, there's a lot of fat in the natural medicine model that needs to be kind of cut out. And that does, I think, give a point of encouragement for health coaches, because oftentimes health coaches think they just need the testing in order to be able to help people. And I can tell you, as someone who's been running all the testing for many years, that tends to not be true the vast majority of the time. So what I do now is really look for, in a partisan way, alternative medicine, conventional medicine don't really care, what is the most justifiable recommendation. I look to be progressive and open-minded, but also not someone who's going to be fooled by alluring promises made by a supplement company, a lab company, or a lab test. Cross-reference all these things with scientific evidence, and also just look at what seems to be efficient in a clinical model. And so now I'm in the clinic a few days a week, and we also work at publishing literature. We've had a few papers published in peer-reviewed journals and more to follow. And I'm just really trying to get people, how do we use alternative natural and functional medicine correctly? And a lot of that, unfortunately, necessitates one to go against the grain, because a lot of the grain, unfortunately, has really been manipulated by supplement company and lab company funding. Just like in conventional medicine, a lot has been a little bit contorted by pharma influence. And it's not to say anyone in a supplement company or a lab company or provider or practitioner are intentionally doing things the wrong way or because they're trying to make money. I just think there's a ton of information, and not many people have enough time to parse that and to look at what seems to be true and not true. If you're a busy clinician, you may not have the days and days and days of time it takes to review the evidence on just one test or even one lab marker. But as someone who does do that, I'm trying to really get the word out about how there's so much good here, but there's also a ton of waste. And if we can just get to the good and cut out the waste, we can get people healthy in a lot less time and for a lot less money, and also avoid them thinking, I can't have any gluten, I can't have any folic acid, these things that just damage people more than they help them. So that's kind of a long version of
No, it's
my
great
origin
though.
story.
So many things to unpack. I actually remember, I can't remember if it was last year or the year before at Paleo FX, and you mentioned the not everybody needs to be off gluten thing, and I just like pearls were clutched and jaws were dropped. And, like, what did he say?
Oh, how dare you? Yeah, I know. Yeah.
But I'm always in admiration of somebody who's willing to just kind of shake up the foundation and not subscribe to any dogma, because it's that nuance, that short line, and the line up toward nuance that we need to get more people in that line. And I guess testing seems simple, especially for the health consumer who's like, I just want to know what's wrong with me. Can you run a test and just give me a diagnosis?
Yeah, so, it's an alluring promise.
Right.
Yeah. So in the interest of cutting the fat out of natural medicine or even conventional medicine, what's the solution? I know that's a really loaded question, but if we're not testing, what are we doing?
Right. And I should clarify, there are some tests that are justifiable, but I would really argue it's probably like an 80-20 test that need to be thrown out to tests that need to be included. Something that unfortunately doesn't seem to be discussed a lot is, for a given condition, taking the therapies that we know work and then organizing them in a hierarchy, which is guided by patient history information, patient presentation information, and then it's evolved and developed over time by the response to treatment. And let's use IBS, Irritable Bowel Syndrome, which I understand that's a constellation of symptoms, true. And there's this burning desire to, what is the cause of my IBS? Like there's this one little thing we can test for, and then voila, this is the cure to your IBS. But that's not really how it pans out, because when you look at how do you take these IBS patients and take them from symptoms to no symptoms, there is not one lab marker that tells you all that. And that's what I thought 10 years ago. Oh, if we can just get a positive for H. pylori or for Candida, then we'll know what to do. Until you see people who have treated that H. pylori and Candida, it's now gone on their lab tests, yet they still have symptoms. And when you've seen that time and time and time again, or the patient with tons of symptoms and all the tests are negative, time and time and time again, you start to figure out that, boy, the testing here is limited. And there are some helpful points and things that can be incorporated into the model by an experienced clinician, but I would still argue that's only a third or a fourth of the data that you need. And unfortunately, the way this is often looked at is, I need that data in order to be able to figure out what to do. And it's such a mistake, because coming back to the algorithm example or the hierarchy, there are a number of therapies that we know work really well for IBS. And when I say work really well, we take 100 people and we give 50 the treatment and 50 a placebo. And we figure out, boy, that worked really well. And we also have studies where if patients have been given that treatment and then another treatment and another treatment and still haven't responded, there's a different treatment that works good for those patients. Right? And so if you start contextualizing based upon, let's say, IBS-C, IBS-D, IBS constipative, IBS diarrheal, now we know that there's a little bit of a nuance in the algorithm that you can build in. The constipative patient may do better with diet with supplemental fiber, whereas the diarrheal patient may be flared by that. So now we can start taking the broad IBS treatments and, depending on your presentation, your symptoms, figure out what of all those should be put into the hierarchy we make for you and which one should not be. And then you simply navigate someone through that hierarchy and you personalize a plan for their gut using their symptoms as a way of gauging if you're getting the therapies right. And wow, who would have thought that if you follow someone's symptoms, you more quickly get to the endpoint the patient wants, which is no symptoms. Patients don't really care about, well, my Firmicutes bacteroides ratio is now normal, yet I'm still crapping my brains out, right? But this is what happens all of the time. And this really, really needs to be remedied, because, to be honest with you, I am sick and tired of seeing these patients show up in my office who think they're complex cases only because the other doctors were only treating their lab results. And I don't mean to give a heavy-handed criticism there, but I really want to try to shake people out of this thinking that these lab tests are such a vitally important piece of information. There are certain areas where this is true. If you want to diagnose hypothyroidism, yes, you will need that, right? Or vitamin D insufficiency or iron deficiency anemia, yes, you will need specific data. But for so much in the realm of IBS, digestive maladies, said more globally, you don't really need the testing. And what's nice about that is it frees you up to think about what are the tools in my toolkit? How do I best use them? And again, that is the most expeditious way to get someone to a point where they don't any longer have symptoms.
Mm-hmm. Yeah. And so I hope health coaches listening to this are sensing a little bit of a sense of freedom here and a little bit of a sense of, I don't have to know it all, because quite frankly, a lot of these doctors don't know it all. And it's really not my place as a health coach to know it all and try to treat and prescribe things. It is a much better focus as a health coach to certainly work with a practitioner who can help you along those lines. Listen to the client, let them listen to their own body. But at the end of the day, look, health coaches work in the world of health, wellness, right? We really aren't illness people. We're wellness people. And to the extent to which we partner with and collaborate with and pick up the ball for a practitioner that's now working that client closer to wellness, we've got to kind of let that go. And we take off the imaginary lab coat, because that's not you, right? We're not doctors.
Yeah. And even for it's not to cut you up, even for the doctors, a lot of these tests, what I find for the majority of doctors, not all, but the more experienced they are, the less tests they tend to order. And so what's really a travesty about this is when a health coach thinks they just need to partner with a doctor to get a XYZ lab account so they can start running these tests, what you're doing is starting on a road that will eventually lead you to realize that wasn't really fruitful. Now, there are some that don't agree with that, but I would argue that there's a lack of critical examination of their model, because if you are critical, eventually I only see how you can arrive at a much curtailed model of testing. But yeah, the point I want to agree with you on is, put aside that I need to have the lab account in order to be a better health coach, because as a doctor who can order any of these labs whenever I want, I'm doing way less of it. There is a line at which, we don't want to go outside of your box. And this is, as an example, with my colleagues in conventional gastroenterology, I know what I know and what my area is, but I'm not going to be making recommendations as to frequency or technique for colorectal cancer screenings, right? Or erosive, gastritis. And so, you stay in the area that works really well. Don't try to go out of that area. Do what you do really well, and then know when to bring someone else in and refer out. So yeah, sorry, I didn't mean to cut you off, but I just wanted to slip that.
No, but that's exactly it. I mean, I guess a question to follow up on that. So a health coach has a client that comes to them. So I'll just use an example. I'm a health coach. I do not market myself as treating GI issues. Right. That is not my niche, but it's not as though I don't have clients that come to me with these issues, right?
Sure. Yeah.
So what would your recommendation as a practitioner be for a health coach that finds themselves in that situation? As far as where to go, there's going to be, first of all, stay in your lane, focus on wellness, focus on behaviors, focus on habits, healthy eating, that sort of thing. But what do you think would be really the appropriate next step for a health coach who's finding themselves needing to, partner or refer to somebody? What would be a good next step? How should a coach handle that?
How should they handle making the referral or knowing when to make the referral?
Yeah, knowing when and that's a big part of it. And yeah.
Well, that's a question I've thought a lot less about, to be honest with you. But we are starting at the clinic now and at the institute to hire health coaches. It's been something I've been wanting to do for a while, to be honest with you. I've just been really busy, and I've finally only gotten around to it now. So I haven't given that a ton of thought. But as an example, in my book, Healthy Gut, Healthy You, I lay out a bunch of things someone can do all on their own. So it would seem reasonable that you could look at that as kind of a series of guidelines for what you can do. And I mean, all these things can be done by an individual on their own, and you may feel adequately informed to guide them through some, and then not others. And so I'll you know, along the Healthy Gut, Healthy You protocol, we start with diet and lifestyle. Obviously, I would be inclined to think a health coach could tackle any of that.
Yeah.
Sleep, stress, exercise, time in nature, and then diets. Paleo, low FODMAP, really, you know, I think the two kind of foundational diets, potentially a little nuance of trying a low histamine diet, carbohydrate intake, meal frequency and fasting. So just there, you can get a lot out of those changes. And I would also submit, kind of in the same theme of reducing waste and trying to be more efficient, with most diets, I really think it's a mistake to think, well, we're going to need at least 6 months on this diet. And even if you feel really terrible at first, you've got to stick with it because it's a peeling of the onion and it's a detox. It's not what I've seen in the vast majority of cases. Usually if a diet's working, you'll have indications of that. You'll have a positive response, not a complete resolution, but a positive response within 2 to 3 weeks. Mm-hmm. And so if you get that, then you can do a quick trial. You know, we'll do this diet. I'll see you in 2 to 3 weeks, and then we'll reevaluate. And if you're feeling great, we'll coast. And if you're not, we'll go to the next diet. So there you have paleo, there you have low FODMAP. Maybe somewhere along the line, you try to integrate fasting to a degree. And so pretty quickly, you can get someone through the dietary phase, figure out when you find the diet that seems to be improving them, where they plateau, right? So let's say low FODMAP is a diet Susan feels best on. Okay, now we have to give her body a little bit of time, maybe 2 months, maybe 3 months to see where she plateaus, right? Because how you feel at week 2 on a diet may not be the same level of improvement that you feel at month 2. So first we want to make sure we're on the right track. Then we want to make sure we give the body time to plateau. And then if you plateau at a unsatisfactory level of improvement, then the second step, again, just using Healthy Gut, Healthy You as one example, involves integration of probiotics and enzymes. And that's something else I would, you know, I'm not sure if health coaches have to be careful about making certain supplement recommendations. But I don't know what the laws there are, nor do I know if they've even been well fleshed out, but it seems reasonable that you could make a soft recommendation about something that someone could buy at Whole Foods on their own anyway, and offer them some guidance with how to use those things. And then perhaps as you're getting a little bit further, the next step is using antimicrobials and doing more of a kind of herbal killing phase. Maybe that's where you say, well, this is a little bit outside of, you know, where I feel comfortable. I'm not sure what the optimal response looks like, and maybe there's certain reactions I'm not sure how to troubleshoot, and so maybe that's when you kind of hand off. But I do think that if the provider and the health coach are working in the same kind of model, and this is what I'm so excited about for the health coaches that we're going to start bringing into the clinic and into the institute, we can train the health coach on how we start the model, and then all that data gets incorporated into their file. And then when they come to me, I've already got everything just the way I'd like to see it. Okay, they did this dietary trial, here was the response. They tried that one, here was the response. They went on the initial probiotic protocol, here was the response. And boom, now they are right where I would have gotten them anyway, but they've done that at a lower cost and presumably with someone who's more available for frequent follow-up visits. And now we can continue right from there. So that's where I think there's this real beautiful chance for synergy and integration between health coaches and doctors, is if we can get them in the same model, and then the health coach starts, and when the time is appropriate, all the information is packaged just the way you'd like it to be and handed off to the doctor, and then they go from there.
Yeah. You know, I think the client likes that experience too. And in my my experience, I had a couple clients with some, over the years, with some very bad gut dysbiosis that was super out of my league, basically. And I said, let's try this diet stuff, let's try this lifestyle stuff. And when it got to the point where they weren't seeing the improvement in symptoms, to your point, in a few weeks, it was like I found for them in their city a functional medicine gut health specialty doctor. I said, can you go to this doctor and get some stool samples, whatever, I don't know, done, go see this person. And the client really liked that. The client liked that I was staying in my lane and that I had a resource for them to, you know, this might be a little bit, you might need a little bit more help, so here, go see this person. So it's a great experience from the client perspective, just for any coaches listening. But to cycle back on the topic of testing and how health coaches should take off their lab coats, whenever we say this, and Laura and I say this all the damn time, we say it all the damn time, we're always telling coaches to just like stay in your lane. two areas where coaches kind of push back on us are, well, what about food sensitivity testing? And what about mineral vitamin deficiency testing? What are your thoughts on those types of tests?
Well, food sensitivity testing is one I can speak more to. So let's start with that one. And sorry to keep referencing back to Healthy Gut, Healthy You, but it kind of puts all this stuff with a nice little bow on it.
It's a great resource. It really is. I've bought the book. I've read it. I've let a bunch of people borrow it. So it's a great resource. And thank you for bringing it up, because it'll give our coaches something to go back to. And
right. Yeah. And that's why. So there is a section on food allergy testing in Healthy Gut, Healthy You. And I remain open on food allergy testing, but it doesn't really seem that the food allergy testing provides much of benefit unless someone needed a piece of paper to tell them to try elimination and reintroduction of the common foods that, through the nutritional community looking at this for 20 years or so now, more intently, have figured out here's the most common food allergens. And so what we can do is just have you avoid them and then bring them back in. And if you notice improvement and then regression, that firms up your intolerance. Now, the promise, and this is the reoccurring theme with testing, the promise is that the labs can allow you to do that more accurately. But again, as I said earlier, that promise is majority not true and not fulfilled. And I would say most of the time, the remark I will get from a patient who's done a food allergy test prior is, yeah, some of these foods that my test says to avoid, I feel great on, and some of the ones it says I can eat actually flare me. Right. So you see that plenty of times. Now, part of the reason for this is likely because food allergy testing is not assessing carbohydrate intake, and some people are more or less sensitive to carbs than others. And that kind of ties into FODMAP tolerance, especially if someone has digestive symptoms. They may not have an allergy to a food, but they may have an intolerance due to digestive tract overgrowth of bacteria, as one example of what may explain why some people are FODMAP sensitive. Nor does it account for histamine. And histamine intolerance is something that affects other subgroups of patients. Now, yes, there are studies that we can point to showing that if we tested someone and they showed a response to gluten or to dairy or to nuts, they would feel better when avoiding those foods. That data is out there, yes. But to say someone has to spend $500 to $1,000 and probably wait 2 to 3 weeks to figure out what they could figure out in 2 to 3 weeks for free on their own, I could have a patient following up 3 weeks later and we've determined what their food intolerances are. And that would be the first day of the results of the food allergy test. So I am now 3 weeks ahead of you, $500 to $1,000 less expensive. Right. And so when you have every interval like this in the model that I advocate for as compared to the other model, this is why routinely other functional medicine clinics will be doing $3,000 to $10,000 worth of lab testing. And we are doing $300 to $800 worth of lab testing. Right. And I mean, this is how you get to those, what may seem like an inflated number. So, coming back to your question, the food allergy testing, there is data there, but if we take a broader view, it's hard to justify that. Now, the one other thing that's used as a counterargument is, well, we need the results to motivate the person into compliance. And I don't know how rigorously this has been studied, but certainly from what I've seen, fear is really only a short-term motivator. Right. And so over time, someone's eventually going to drift back unless they've experientially noticed, like, boy, every time I have dairy, I feel bloated. So I'm going to curtail my dairy intake. Eventually, if the lab test said, don't do dairy, and then 4 weeks later I had a little bit, I felt fine, I'll probably have a little bit more in 2 weeks, and then eventually I'll drift right back onto it. Which, I mean, rightfully so, right? If there's no experiential reason why you can't have that food, then again, I would argue that the fear-based test as I can't have this is really only a short-term motivator. And then, I'm sorry, what was the second part of your question?
Vitamin and mineral deficiencies.
Oh, right.
Coaches think they want to play with.
This is an area where I haven't had a chance to review all of the data. I have seen some programs, although, if I'm being totally honest, and I don't want to sound disparaging, but one of the things that I look to when I don't have the time to spend the days and sometimes weeks to evaluate all of the articles and the merit behind the articles and recommendations. I look to the person who's making the recommendations. Are they an experienced clinician who seems to be practical? And do I have the sense that this person is trying to get to the bottom line? Or does this person seem to be the type of person that falls in love with complexity for the sake of complexity? And that's actually a pretty effective filter to use, because the people who really like complexity will make something more complicated than it needs to be, right? Because that's what they like. And for the people who are looking for, okay, what is the bottom line here? What is effective? How do we take all these, snippets of data and cull them down into a set of effective recommendations? That's what I look for in how someone articulates their argument. And as an example, here's two articulations of an argument. We know that vitamin D affects parathyroid hormone, and parathyroid hormone may affect calcium levels in the blood. So we're going to look at the ratio of calcium to parathyroid. And if that ratio is in excess of this, then we are going to recommend that someone either gets more vitamin D or they supplement with vitamin D. And this is based upon the fact that we know this hormone has X effect on metabolism. So that's kind of the complex argument. The argument I would encourage people to look at is, we know that people who have vitamin D below this level have a decreased quality of life and higher death rates. So it seems logical that supplementing with vitamin D and hitting a level of just arbitrary 40 leads to better health outcomes. And in fact, when we look at population-wide surveys of people with a vitamin D level of 40, they tend to be healthier. So do you see, like, one is looking at outcome data and the other is looking at a mechanism and then theorizing as to what we should be doing based upon the mechanism. And that actually makes a really big deal, because mechanisms are oftentimes, they're either incorrect or they're incomplete or they're not that impactful. And this is one example. We just had Tommy Woods on our podcast, and he did a phenomenal job going into and debunking the utility of gene testing. And the FTO gene is a gene that's supposed to predict a weight gain, which it does, right? But it predicts about 0.5 pound of weight gain. And as Dr. Woods put it, if you go to the bathroom before or after you weigh yourself, that has more of an impact than the gene. So that is a mechanism, right? And there's a theory that that mechanism will lead to an outcome. But you could be wrong, because there's a big leap between mechanism and outcome. But when you look at outcome data, meaning these people were treated as such, and here's what happened, that is going to be much less prone to being correct, because now you've actually run the experiment that the mechanism was suggesting. So the mechanism suggests that the FTO gene decreases your metabolism, ostensibly. But when we look at the outcome data, it only has an impact of 0.5 pound or less. So you look for that in how someone articulates their argument. And if the argument is all this mechanistic speak, it's not to say that they're wrong, but I would argue that it's much more prone to being correct as compared to the person who's looking at the outcome data or interventional data, much more prone to be right. So coming back to the question of micronutrients, I see a lot of theoretical and not a lot of good kind of outcome data, save maybe vitamin D, maybe iron. I think B vitamins and homocysteine are debatable, but hopefully that helps people kind of navigate that. And what I recommend people do when they're wanting to know if they have insufficiencies is, first, get your gut as healthy as you can, because that likely will impact your absorption. And then the other would be track the food that you eat. I think Chronometer is a great way to track it. And then go back and do a month-long analysis, and you'll get a printout for you are deficient in X, Y, and Z. And then look up foods that are higher in that and improve your dietary intake. And that seems to be a much better method, because if your test says you're deficient in X, Y, or Z, well, you have to eventually get to the cause of that, unless your treatment's always going to be just take a bunch of vitamins. And so you can improve that in your diet. And then for things like anemia, someone may require supplementation with hydrochloric acid as one example. But I haven't reviewed that data, but that's the way I typically recommend people approach it.
That definitely landed. I think you hit the nail on the head when you said that it was, maybe I'm paraphrasing, but it's almost like the coach who's seeking out this micronutrient testing is seeking out complexity. And maybe the complexity makes them feel more
like it's more correct.
Yeah, viable,
Right.
something. But when we connect back to the symptomatic experience of the client, well, first of all, that solves the problem the client came to see you about, A, which is why they're paying you, and B, it's also empowering to the client.
Mm-hmm.
Like, oh, I made myself feel better. Look at that.
Right. And also, if we look at the evidence-based model, for the audience, there's a pyramid model in medicine, and it's designed to help clinicians make the best decisions that they can. And if you picture a pyramid, the bottom of the pyramid, meaning the lowest quality of evidence, is mechanistic evidence. The pinnacle of the pyramid is actually clinical trials or summaries of several clinical trials. So if you like medicine or not, you can't argue with the fact that the evidence-based pyramid does a good job of guiding decision-making. And albeit not being perfect, certainly we know that if we have a clinical trial, an interventional study, that is more important to look at than at the mechanism. But unfortunately, I think what happens is if you have a hypothesis that you just want to be right, you can pick any kind of mechanism, and the challenge is there's likely something in the pinnacle of the pyramid that contradicts your mechanism or your hypothesis, but you don't want to see that. And I'll give you one example. At PaleoFX, years back, someone was going through this presentation about this new miracle fiber that was conveniently in a new product this person had just released, and how this was an incredible therapy for weight loss. And the entire argument was mechanism. And it was really frustrating to know that we've given this to people, and the weight loss on average has been between 1 and 3 pounds, or 2 to 3 pounds. And that's mainly in obese subjects who aren't doing anything else. So to see 2 to 3 pounds of weight loss in someone who's 100 pounds overweight, really nothing to write home about. Yet that was not included in the presentation because it's not as attractive as when these people were given this fiber or prebiotic, this anti-inflammatory enzyme in the gut was upregulated. And we know that enzyme helps unlock hormone-sensitive lipase, which is how you burn fat on a cellular level. It sounds so appealing, doesn't it? Until you take that hypothesis and you put it into a person and you go, man, only the obese people lost weight, and they lost like 2 or 3 pounds. Whereas look at this paleo diet research, people are losing over 10 pounds on average by changing their diet. Well, let's not mention that because that's not going to be good for sales. Or sometimes people are just unaware of the evidence-based model, which is a real travesty. And so they just kind of go looking for what reaffirms their belief, which is confirmation bias, which is the entire reason why the evidence-based pyramid model exists, because you pull from the clinical trials that are placebo-controlled, so that confirmation bias is kind of guarded against. But yeah, I mean, those are just some things to look for in how someone articulates arguments. And it's really, again, if I'm being really candid, it's sad because people tend to fall in love with these complicated hypotheses.
Yeah.
And I look around and I see so many people who are floundering in functional medicine. And it's really unfortunate just, watching people walk off the cliff because it looks attractive when these things are not that complicated if you just have the right framework for analyzing information.
Yeah, it's like the Siri telling you to turn left, and you turn left and you walk off the cliff because you're just blindly following these mechanistic instructions.
Yeah, it's so tempting. And just as a parallel for health coaching, Aaron and I have both witnessed this. And look, when I first started, I did this. I was guilty of this, where I was making things more complicated than they need to be. I felt the need to just, my client clearly needs to know every nitty gritty detail about whatever it was that we were discussing in order for them to be successful. And I ended up just complicating the matter and making them more confused. Right. And I just look back and I would just forehead slap, and now, even though I know more, right? I've been doing this longer. I know more. I've got a lot more experience. The actual amount of information I just sort of emanate in any one session is a fraction, right? From client to client, we're working on like one thing. And I have always found that if information is going to be better received when it's relevant in the moment and they can do something with it. Right.
Wisdom leads to simplicity.
Yes, it just make it simpler. And I have learned, and because I spent like 20 years in finance, which is another arena that gets really complicated and lots of jargon and lots of big fancy words.
Sure.
And I always learned, God, I always knew which advisor was a good advisor. And now I know which doctor is a good doctor or which coach is a good coach. Is if you can explain it so my 6-year-old can understand it, then you know what you're talking about. Yep. Right. And if running all these tests is just going to make you more complicated, and I'm really interested in hearing a little bit about this, the genetic research and how he debunked that use, because that comes up a lot too. Yeah. I would love, can you give us the inside scoop on that?
Well, part of the inside scoop is really tied into what's known as effect size. So effect size is the magnitude of benefit. And again, this is where if you apply the framework of analyzing information that we just covered, you will not be misled because you'll be looking to outcome data, which looks at effect size. Right. So that's the issue with the fat gene, the FTO gene, is, yes, in a analysis, that gene does lead to a statistically significant weight gain. True. Now, if it's mathematically or statistically significant, it doesn't mean that it's what one would consider clinically meaningful. And this is the huge discernment that needs to be made. So if half a pound or less is what a client would consider a clinical win, then sure, right? But most people would not consider half a pound highly viable. And I don't recall the exact numbers here, but the same thing essentially holds true for MTHFR. Now, okay. I didn't know the exact magnitude of the effect per se, but what I did do was look at some of the outcome data. And it turns out there was one Asian study that looked at a large number of people who all had MTHFR positive for their polymorphisms, and they were given folic acid, which purportedly is like killing people. It's like having them drink battery acid. So the theory goes. Yet in this population, there was a 30% reduction in stroke risk. The same thing has been shown for ApoE4, 3433 guided diets to see if a gene-guided diet would reduce or improve a cardiovascular lipid profile. And when that was assessed, the gene-guided diet was no better than the healthy reference diet. Further, there was a study at Stanford with Christopher Gardner, who's also been on the podcast 2 times, a really, really sharp gentleman. And in his Diet Fits trial, they were looking at certain polymorphisms or genetic changes that may predict insulin sensitivity and therefore may tell us who does better on a lower carb diet. And no improvement or no benefit from putting those with these gene polymorphisms in a group that was either higher carb or lower carb. So while these things are attractive, when you get out of the realm of mechanism, which all these snippets or SNPs, they impact certain mechanisms, true, right, but they don't really seem to be impactful enough to be relevant. And this is the take-home point of the episode, and this is what we entitled the podcast, was genetic testing does more harm than good. And the reason for that is, as Dr. Woods describes it, is when you have a gene test come back positive for any of those genes, these are usually bad things, right? Things that you don't want to have. Now, we know that acting on that does nothing, as we just outlined, right? But we also know that it causes people to be fearful and scared. And he actually cites one study for, I believe it was twitch fiber type in muscles. And they studied what would happen when you told someone they had this gene or didn't have this gene. And even though the impact of the gene was negligible, when you were told this gene predicts that you will be less responsive to strength training. Those people actually perform more poorly in their strength training. So SIBO, which is a negative placebo effect, people with these lab tests, and you do nothing to help them. So if we take a negative plus a none, that gives us a net negative effect. So therefore, the conclusion, genetic testing does more harm than good, with the exception of conventional medicine gene tests that are known to be tied to disease, that have certain treatments, which are incredibly rare, but But for everything in this realm of natural and functional medicine, COMT, MTHFR, ApoE, FOT, all these, there doesn't, and I am open, but every time I've gone and looked for, okay, when this hypothesis has been tested in a outcome model, there really doesn't seem to be anything that holds any water. And so unfortunately, this is one of many a thing that if we cut out of functional medicine, we will actually get better results.
Yeah, I'm pleased to hear that, because Laura, you had the ApoE4 thing, don't you? The reason why I'm happy to hear it is because this is gonna sound really weird, but bear with me. I haven't had any testing done, and I haven't had my blood drawn in years. I don't even remember the last time. Decades, honestly. I don't know what my blood lipid panel is. I don't know what my genetic make. I don't know any of this stuff. And I like not knowing, because then I can connect into what my body's telling me. And I try to teach this to my clients to really trust as much as you can the signals your body is giving to you. Like that's symptomatology basically, but trust that, if you're feeling good, then why go get your blood lipid panels drawn? That's just my kind of weird opinion. But I kind of like to your point, or Dr. Tommy Wood's point is like, sometimes the test results will oftentimes impact our behavior or our belief about our opportunities for health. Like, oh, I'm done for, I've got this gene. Oh well, I'm certain that in my genetic makeup, if I look back on my maternal sort of lineage, it's probably not all rainbows and sunshine. I don't know, just based on how my maternal ancestors all kind of died of chronic illness. Who knows, right? But I'm choosing not to let that cloud my judgment, or my client's judgment for that matter.
Right.
We get to connect back to
and I fully agree. And to that point, another point that Tommy makes is that while some of these genes do predict risk, the dietary and lifestyle interventions that we do foundationally have way more of an impact than does the genetic risk that is posed. So at the end of the day, the gene testing doesn't really affect how we would treat you in any way. We come back to the same stuff. And just one thing I want to piggyback on that, just kind of agreeing with and exemplifying your example, which I think is generally true. I would say not a bad idea to follow up with your conventional doc, maybe on a yearly basis, depending on what you have going on. If there's a family history, let's say of Hashimoto's and hypothyroid, perhaps you're screened, for that periodically. But oftentimes, to your point also, the screening tests are going to be much more prone to actually find something if you have symptoms, right? But as one patient sticks out in my mind so clearly, she had SIBO, and so she was avoiding fruit. And she asked me, Dr. Ruscio, will I ever be able to eat fruit again? I know I have SIBO, and I've read that you shouldn't be having fructose if you have SIBO. And I said, well, how do you feel on fruit? She goes, oh, I feel great, but I've been avoiding it for 6 months, ever since I had that SIBO positive breath test. Then eat fruit, right? The SIBO breath tests are not the end all be all, not to mention that many times the SIBO breath tests are misinterpreted. They're grossly misinterpreted, meaning you're 2 points over the cutoff at the very end of the test. And technically that is SIBO breath test positive, but does that mean someone has to go to drastic dietary changes? No. And as a perfect example of it, this gal made dietary changes that clearly made her feel worse based upon a lab test, which is really unfortunate. And then she went right back on with my go ahead. And she said, boy, I feel great. I'm not sure why I was avoiding fruit. Well, it was because she was scared into that based upon this monkey business on the internet, which is, it's well-intentioned. But I think this is a problem where, we fall in love with these hypotheses and these mechanisms down in the weeds, and we lose sight of the fact that not everyone with a SIBO breath test positive needs to be avoiding fruit. In fact, I would go as far as to argue that much of the field, they're using tests that are more so in the research and discovery phase, in trying to use them as clinicians. And it's a really big problem. And the testing for analysis, pattern recognition, and for learning to inform the clinical model makes a bit more sense. But unfortunately, we have so many clinicians using tests that are still kind of in the R&D phase, as if they're clinically tried and true and tied to different, treatment predictions. And that just causes all sorts of problems.
Yeah, at the end of the day, you're so right, because whatever your genetic test comes back at or whatever, but at the end of the day, what's the so what and how are you going to use it? And what, and at the end of the day, for most of my clients, a nutrient dense whole food diet, getting out and moving more, getting to bed on time, managing their stress, spending more time outside, we're going to use the same model, right? Maybe you'll make some minute differences, but I think most people know at this point, if I eat too much sugar, I don't feel well, or they'll notice dips in their energy level when they eat too many carbohydrates, or they'll notice when I eat broccoli, I start to feel really bloated. Like it all goes back to how do you feel and what is your body telling you, and exactly what Aaron was saying.
Yeah.
So thank you so much for breaking all that testing down, because I do think there's a lot of pressure. Health coaches, I think, feel as though they need to be able to work with those in order to justify charging people for helping them.
Yeah.
And being paid to do that. And that's not, we're just not in that realm. That's not what we do. We do something completely different.
Yeah.
Now,
we need to get off of this thinking that we need, and I understand where this comes from, health coaching, natural medicine, it's a younger field, doesn't have the academic, reputation that other types of medicine have. So I get trying to put your best foot forward. But unfortunately, using tests that have poor to sometimes no scientific support or validation, although seemingly on the surface looks scientific, is actually quite ascientific. What would be much better would be to look at therapies that have evidence for them, and then using those therapies as such. And just as one other quick example, there's a somewhat newer therapy known as Immunoglobulin Therapy. And this has been shown in a number of studies to really help patients who've been through a bunch of other treatments and haven't responded. There's no test that says this is the best time to use immunoglobulin therapy, yet it really helps patients who've gone paleo, failed, well, FODMAP, failed, been given rifaximin because let's say they had a breath test positive for SIBO, failed, been given antispasmodics for their abdominal pain, failed. Yet we give these patients immunoglobulins, and due to the fact that they bind toxins and irritants in the gut and kind of deactivate them, and therefore they seem to reduce the inflammatory response, they work. So this really promising new exciting therapy doesn't require any lab testing. And there's many like that. There's not one study that has shown a certain test means an individual should use a given probiotic. Yet you have droves of clinicians saying, well, that stool test showed low lactobacillus acidophilus, so we're going to give lactobacillus acidophilus, never minding the fact that in your history you've used similar probiotics and had negative reactions. We see it in the lab tests, therefore it's got to be true. Right, so it seems logical.
Let's speak to that.
Yeah, it seems logical that, well, if you're low on the stool test, then that should be what we give you. But when we zoom out and we go, well, has there been a study that stool tested patients and then made a custom tailored probiotic based upon the results? Nope. But we have droves of studies finding that patients with SIBO will clear SIBO if they're given a probiotic, or handfuls of meta-analyses showing that patients with IBS will improve their symptoms when given a probiotic, or other evidence showing that probiotics can improve mood in those with anxiety or depression, without any predictive testing telling us how to do so. But somehow in the model, there's this thinking of, well, stool test said I was low in Bifidobacterium infantis, so I got to make sure to get that in. That exists, resides out there in the community. Yet I have not seen one study, and I think I've read the vast majority of probiotic literature that demonstrated that. So just another example of how we're making things more complicated than they have to be, at the same time while ignoring the wealth of amazing outcome data that we can use to guide a treatment model for a patient.
Right. So the probiotics, because this came up before we started recording, and I've read your book, and you've talked about probiotics and the proper use of probiotics and how they might be used inappropriately, or they're not a panacea for everything. They work really well for certain things and not so well for others. Could you speak to that a little bit and give us some clarity there?
Yeah. And if you don't mind, I'll also refer people to the homepage of our website. We have our probiotic starter guide, and it's really short and kind of lays out some of these foundational pieces. And then at the end of that starter guide, we link to our comprehensive guide that goes way into detail on all this. So if people wanted there's kind of the flow. But yeah, where to start with probiotics? So maybe one of the most common canards regarding probiotics is that if you have SIBO, you should not use them. And this is perfectly exemplifies what we've been talking about, which is the mechanism versus outcome data, right? Now, the mechanism, the theory, well, you've got too much bacteria in your gut due to SIBO. Therefore, you should not take supplemental bacteria, i.e. probiotics. Makes sense. But when we look at I believe to date there's been 8 clinical trials, even summarized in a meta-analysis, meaning we take SIBO patients, half are given placebo, half are given a probiotic. We clearly see time and time again in these studies, pretty much everyone that's examined this has found that probiotics can decontaminate SIBO, or clear SIBO, and also reduce symptoms. In fact, one study even looked at patients who, they all had IBS, but one group had SIBO and IBS, and the other group had IBS without SIBO. So they all had symptoms, but some had SIBO and some didn't. The group that also had SIBO actually responded better to the probiotics than did the ones without SIBO. So go into my clinic, and unfortunately, tons of patients have been avoiding probiotics because they had SIBO breath test positive at some point. And it's really unfortunate that patients have to wait to see me and pay them money to see me to then have me put them on a simple probiotic protocol and their symptoms go away. But that happened. I mean, it happens more than it should happen because for some reason in the community, the mechanism seems to be more of an attractive story than does the actual outcome data, which shows that probiotics can be very helpful. It's not to say that there's never a patient who reacts negatively to probiotics, but if you're using a probiotic of any decent level of quality, that should be pretty minimal. It also leads into something that you see in the research, but it's not always fully spelled out, which is most of these studies use one of 3 types of probiotics. The traditional are your lactobacillus and bifidobacterium blends. The strains vary a little bit from study to study, but there's mostly this overlap. Various lactobacillus, various bifidobacterium is the predominance of what you see in the formula. That's what I call a category 1. Other studies, and there's about 500 trials looking at that type of probiotic. Then there's about, I believe, 100 trials looking at Saccharomyces boulardii, which is a healthy fungus. And then there's about, depending on what data pool you look at, maybe 14 to 24 studies using this third type of probiotic, the soil-based or the spore-forming probiotic, kind of a newer probiotic popular in the paleo community. And there's about 14 trials using this type of probiotic, which is predominantly comprised of various bacillus strains, Bacillus licheniformis, Bacillus subtilis, Bacillus clausii. And so when you realize this, you realize, okay, here's the 3 main formulas. And if someone's reacting to a probiotic, it oftentimes is one of those formula types that they're reacting to. And when you realize that, you can say, okay, I've reacted in the past negatively to VSL3, which is category 1. And I think the Healthy Trinity by Natron is another one that's similar. And so if you see that in their history, okay, your gut does not tolerate a categorical type 1 probiotic. So we're going to go to then the Saccharomyces boulardii and the Bacillus. And that's how we can personalize a probiotic protocol to one's gut. And that can get you around many of these problems and reactions, albeit being very rare. The other thing, Labdoor performed a study, and I believe they found that 43% of probiotics in the market did not fully support their label claims. And there's been a few different analyses done that have essentially found that probiotics oftentimes do not either meet their label claims in terms of potency or the organisms that are actually in the probiotic. And so it is possible that these reactions could be coming from using a formula that has been corner cut and may not be viable, may have other organisms in it than the ones listed on the label, or may be filled with a fair degree of filler or prebiotic, which is much cheaper, and people are actually reacting to the prebiotic. So, as someone who sees pretty sensitive patients, as a subset, even the most sensitive patients can usually tolerate at least one categorical type. But better yet, if we can try to have someone use all three. And the analogy I use is, if you picture a stool like that you would sit on, one formula is kind of like a one-legged stool. It's conducive to balance, but it's a little bit wobbly. But if we have the lactobifido, if we have the Saccharomyces boulardii, and we have the soil-based, that's a really solid support structure that's more conducive to supporting balance in the gut. And so that's what we aim for. And that can be quite effective. We've published a case study with Phyllis in our video newsletter now, maybe 6 months ago. She had been on paleo, then she went on low FODMAP, and she had seen some, maybe 30% improvement from that. She had tried various probiotics and was still kind of floundering. The one thing we did when she came into the office, put her on all three probiotic categories together, and within 30 to 60 days, all of her symptoms are gone. And she's not alone in that experience. So those are a few things regarding probiotics that I would offer people. And there's a lot more we could talk about there, but definitely a fair amount of confusion, unfortunately, regarding probiotics.
That's amazing. I had never heard of the categories. So right off the bat, that's a learning, a takeaway.
Yeah, well, good.
Yeah.
Awesome. So just to kind of close the loop on that then, ideally everybody has a balanced stool with, it's funny that we're using a stool because it's like, stool.
Yeah, overlap there.
But our balanced little chair. But a person could have an intolerance to one of those kinds. So you're kind of sussing out to see if they can tolerate all three. And if they can, then yes, have all three. But if they can't, then take away the one that doesn't support them, or is that
exactly? And I kind of want to show you this diagram really quick, if you don't mind, because I think it helps bring this to life. Can we do a quick screen share? Is that cool?
Yeah.
Yeah.
So let me pull this up here, because this, I think it makes it a little easier to see. Okay, so this is, you can see this?
Mm-hmm. Yeah.
Yeah, so that's the analogy that we use to, help make it a little more easy to kind of tie to. Because, and this is more so my inference, but I think this is somewhat well supported. These probiotics may act differently and support different niches in the gut. So the lactobifido blends are lactic acid forming. They have a certain type of function that they support. Saccharomyces boulardii, different. Now, exactly how, I think that's still being mapped out, but I think it's fairly safe to presume that a fungus is going to act differently in the gut than bacteria, albeit both supporting the gut in a healthy way. And then the category 2, the soil-based, may be a bit more prone to actually colonizing the individual, which is maybe something that we should touch on, that most probiotics don't colonize, but rather they have a transient benefit. They're anti-inflammatory, they reduce leaky gut, they help to fight fungal and bacterial infections and overgrowths. In fact, some studies have even found that either antibiotics or antifungals work as effectively as a probiotic, which is great news, which means we don't need this exotic stool test to diagnose an imbalance. I mean, again, there's caveats to this. If you have chronic acute diarrhea, go get checked out, right? But if you have these lingering things and you're thinking that your chronic gas and bloating is due to candida, many cases of candida can be resolved by a probiotic. And we have studies that have looked at antifungal drugs compared to probiotics and shown equivalent benefit. But this is the three categories. And the reason why I think they work so well together is they all, again, more so in accordance to my theory than to what's been published, may act to support the gut in uniquely different ways and support uniquely different niches in the gut. So that's just kind of the visual there to help
I love that.
tie that together.
So I can't believe that all these probiotics are not doing a good job of actually colonizing.
Yeah, it's some do, but and this is interesting because sometimes you'll hear someone say, "Oh, what do you mean? You believe in all that probiotic stuff? They've been trying to colonize you." And again, it's like, how many times are we going to go down the mechanism? And in fact, I had a friend of mine say this to me the other day, a really smart doctor. He goes, "Oh, you believe in all that probiotic stuff? But they've been trying not to colonize you." It's like, okay, this is true, but have you looked at when we take IBS patients, the hundreds of clinical trials that have found IBS patients improve from the probiotic? So irrespective of the mechanism, these seem to be helping. And there are other mechanisms like the fact that they're antibacterial, antifungal, anti-inflammatory, anti-leaky gut that likely explain why we're seeing the important outcome measure, people's symptoms vastly improve. So yeah, it's, you know, I don't mean to be getting overly passionate about this, but it is frustrating when you see time and time again, if we could rectify our thinking to not be so obsessed with mechanism and rather to focus on outcome data, we'd be vastly more effective in how we help people, all the way from health coaches all the way up through doctors.
Yeah. Well, at the risk of sounding mechanistic for a second, because IBS, I would say, is 100% of my clients present with IBS at this point, like 100%. So as a coach dealing with IBS clients, do I just start encouraging 3 different legs of probiotics? Like, how do you encourage a coach to sort of step the client? Like, here, take all these and tell them, or one at a time.
Great question. Yeah, and I think there's, and this, I definitely wouldn't say this is mechanistic. This is more clinical, right? This is, you know, how do we apply this stuff in an efficient way? This is the beauty of, you know, how do we take all this info and then codify it into an approach? And the way I approach this is if someone has a history of being quite sensitive and quite reactive, it seems advisable to start the probiotics one at a time because they have a higher likelihood of reaction. And so if we can pinpoint the reaction, we can adjust the protocol to them more easily.
What about the client who doesn't have any kind of history with probiotics?
Well, then I would look to, and how I mean that is just in general, right? Are they sensitive to things in general, right? So I took a multivitamin and I felt like I had a racing heart. And one time I tried ashwagandha and it kept me up. And then one time I took magnesium and, you know, I broke out in hives, right? So if you're hearing that kind of thing, I mean, if someone's reacted 1 or 2 times and they've done a bunch of experimentation, not a big deal, that happens. But if there seems to be this trend, and this is why, you know, a supplement history is really helpful, or a treatment history is really helpful. If you see that trend and you're getting a little bit of a suspicion flicker there, then go one at a time. Irrespective of it's been with probiotics, but obviously if they've directly reported, you know, reactions to probiotics, and do it a one at a time, introduced every maybe 3 days to a week, just depending on how they notice their reactions time, right? And just, all you're trying to do there is just achieve, we bring one in and has enough time passed to qualify that that one's not causing the reaction, so then we can then bring in the next one. And if you don't see that, then you can start all 3 at once.
Great. And so I guess if a highly sensitive person that is just, their gut is just in such a tailspin that everything's affecting them. So we need to just be gentle with the probiotic protocol. Is that kind of the thinking there?
Yeah. And then also just, you know, some people tend to be more reactive than others. And it doesn't always connect to how symptomatic they are, because there's some people who are symptomatic digestively, but they're just not reactive. Right? They don't react negatively. It's just they haven't gotten the right support to quell all those GI symptoms. Yeah. And then there are some patients who are just exquisitely sensitive, and it doesn't seem to always track with their gut, because they may say that they get skin reactions, joint reactions, neurological reactions. So yeah, it's a more complicated question to answer, but you know, how we navigate that stays kind of the same.
Gotcha. So, I mean, clearly not all probiotics are the same, right?
No. So here's an interesting quick story. So we make our own 3 probiotics. So the 3 that we make are the ones that I recommend in Healthy Gut, Healthy You, and they're titled very simply Lactobifidal Blend, Saccharomyces boulardii, and soil-based, just in accordance with the categories to make it easy for people. When we were trying to find the materials for these, we went through probably over 25 manufacturers, and only 5 of them actually met the quality assurance practices that we looked for to be able to qualify this was a good and healthy probiotic, which means not only GMP or good manufacturing, that's kind of the floor, but you also have to do independent testing for potency, viability, and the actual species that are contained in them. And you'd be surprised, there are many companies that don't do this. And while I don't think that cost and quality are always directly related, because some companies just market really well garbage and make it expensive, and the velvet rope syndrome, people assume automatically that it's better. But this is partially why some probiotics are $10 a bottle and some are $50, because when you do independent genetic testing for the species of bacteria, that drives up the cost. And then also for some, they have to be kept refrigerated during manufacturing. So quality is sometimes kind of a red herring companies use to jack up the price, but it definitely does make a difference to some extent with probiotics. It doesn't mean that the most expensive is the best, but it does, I think, give us a floor to be cautious about, which is if you're looking around and you see most probiotics, let's say of a given 60 count probiotic, if most are 50 of this type and you see one for 15, there's a good chance that there's a corner being cut there.
Yeah. So do you feel comfortable? So I got to imagine there are probably some brands, common brands that you're aware of that really, when tested, they were not.
Yeah, you'll read
do you
about
mind
that.
throwing some of those out there?
Well,
are they in the book?
Yeah. Well, they're in the probiotic starter guide. You can see the 3 or 4 studies, independent studies that have looked at common probiotics in the market. And if you click through, you can see some of the brands that have been tested. But yeah, and hopefully this will change. Also, to maybe play devil's advocate against my own point, because I really try to be as honest as I can in all these analyses. We recently went back and double checked the literature, and many of the early probiotic studies that found benefit actually did not go through this more rigorous quality assurance process that only has come on the scene more of late. So I can't sit here and say that a cheaper probiotic wouldn't help someone, but what I do think accounts for some of this is why we see in the clinic much less negative reactions to probiotics. I think it's probably because of the quality. So a cheap probiotic may be able to help you. It's likely going to be less potent and may have some other stuff in there. But for a non-sensitive person, that it actually may help them. And there is some evidence to support that. But the trend you're seeing in the literature, and you're seeing the American College of Gastroenterology making statements that current regulations for probiotics are insufficient to protect doctors and consumers. Now you're starting to see these companies start to up their quality assurance bar. So there is some wiggle room there. If someone's on a super confined budget, you might be able to get some benefit with a cheaper probiotic, but just be cognizant of those things so that if you do try a really inexpensive one and have a negative reaction, you may just want to up it to a more quality brand.
That's awesome. This is great. I love these focused discussions that are so tactical and gotta download the guide. I'm going to look for the good probiotics. I'm going to understand this is just such usable information for health coaches. So thank you. And we didn't even get into half the stuff I wanted to ask.
And I just want to make a plug for the book, Healthy Gut, Healthy You, because as health coaches, we have to be very careful about staying in our lane, as we talked earlier. But the one thing that is totally in our lane is providing resources. And being able to point people to resources that are actionable for them, where we can then help the client pick up the ball and provide some direction. So if I were a health coach listening today, and I don't know any health coach that's been doing this for a while that hasn't had clients coming to us with gut problems to some degree. Sure. So the book is great. Going to the website. I'm going to go download that starter guide myself. I'm a geek. I'll probably download the other one too. The more in-depth one, I like to geek out.
Well, so there's one quick thing there that's in the more in-depth guide, and I'm not sure if this is going kind of beyond the scope of what your audience is interested in, but just to throw out there really quickly, there's another argument, and again, coming back to the complexity for the sake of complexity piece, that we have to use the strains that have been published for the given condition, meaning you can't just use any probiotic. It's got to be the specific one that's been used for, let's say, constipation. And so in the comprehensive probiotic guide, I picked this apart. This is not true. And I understand where it comes from, and I like the spirit of it, which is we need to be rigorous and scientific and have evidence to support what we're doing. But there's also this piece of being evidence-based and evidence-limited, meaning you can't think beyond the one study that you have and rather look at all the studies and see a clear trend that answers a question that hasn't been answered yet. So I call it being evidence-based, but not evidence-limited. Now, in the article, I expose how, let's say for constipation, different probiotics have all been shown to be helpful for constipation. So for a lab to say our probiotic is the one that was shown to be helpful for constipation, that was maybe true 6 years ago when there was only one study. But since then, there have been different studies, and they've all used different blends of probiotics. Same thing for mood. Same thing for SIBO. Not only different formulas, but different categories have been used. So that's another common counter argument that's deployed when I go into the 3-category system. And again, I really like where it comes from. But if you really look at, okay, I'm going to drill down into this and look at all the studies in constipation with probiotics and look at the exact formula. When you do that, you see different probiotics have been used in pretty much every study. You see that same thing for mood, that same thing for SIBO. So oftentimes when you fact check, you discover that these things circulating on the internet are not true. So that's just something I'll offer people. And we even recently went back into this again, going all the way down to the strain level. So you have the species, and then you have beyond the species, you have the strain. So there's Bifidobacterium infantis, but then there's also Bifidobacterium infantis L125, Bifidobacterium infantis, G169. And someone recently asked, well, you got to make sure you only use the strains that were published in the research. And I'm going, oh, God, this is going to be a pain in the butt. I don't want to go back into this, but it's a fair question that deserves to be answered. So we took all the research on probiotics, we broke it down by strain, and we laid it all out. And what you see is, let's say there's been a number of studies with different lacto-bifido blend probiotics. Virtually every study, every formula uses a different strain. Mm-hmm. So to say you can only use the strain that's been published in the studies, I mean, perhaps that's true, but if every different strain that has been studied has shown effectiveness, I don't think we have to go to the rigor of saying only a specific strain will do. So I'm all about getting into the details and using those to inform and make us more effective, but some cripple themselves underneath the details because they're making things harder than they have to be. And if we can just get it right, if we can get that right balance, we can be effective and we can be efficient and we can get people healthy more quickly.
Boom.
Boom.
I don't know how you gut folks keep all those strains straight. Boy, oh boy, talk about a rabbit hole. We haven't said rabbit hole yet in this podcast, so I had to get it in there. Every podcast episode in the history of podcasts says the phrase rabbit hole. So we have.
There we go.
It's now been stated. This was so great.
Oh my gosh. Really good. Really good. Thank you.
Can we have you back? Because we got so many other questions we didn't even get to, but now I have to let you go or my children are going to revolt.
Yeah, we should. And we should talk about thyroid because that's another area. And, I don't mean to come off as overly contrarian, but I fact check these things. And not only do I, but there's a team that works with me to really go through the evidence, organize it, and be able to see what is the answer, like with the probiotics. That was only achievable through a team effort, organizing everything into a sheet where we lay out all the data. And then you can clearly see what the answer to the question is. There's similar findings with thyroid, where there's some really helpful things amidst so many mistruths that hurt people that we should definitely talk about at some point.
We have to, because thyroid's the other thing that's epidemic at this point on client intake forms. So we have to do it.
Awesome. Thank you so much, Doc. This was amazing.
Thank you guys. It was fun. It's always fun to be able to geek out. I can't have this kind of conversation over dinner or anything like that. So it's nice to do it.
We're happy to geek out with you.
Awesome. Well, thank you guys. It's been a real pleasure.
This podcast was brought to you by Primal Health Coach Institute. To learn more about how to become a successful health coach, get in touch with us by visiting primalhealthcoach.com/call. Or if you're already a successful health coach, practitioner, influencer, or thought leader with a thriving business and an interesting story, we'd love to hear from you. Connect with us at hello@primalhealthcoach.com and let us know why we need to interview you for Health Coach Radio. Thanks for listening.